Hello, my name is Ruth Erickstrup, and for my presentation, I have chosen to cover Hashimoto's disease. I was initially really interested in this disease because one of my good friends has Hashimoto's, so I just really wanted to learn more about it. Hashimoto's disease is a disease that attacks the thyroid over time. The thyroid is located in the front center of the neck, and its function in the human body is to produce hormones that regulate the body's metabolism, heart rate, digestive functions, brain development, and bone maintenance. But with Hashimoto's, your body's immune system creates antibodies called thyroid peroxidase antibodies, or TPO, or thyroglobulin antibodies, or TG, which will then gradually destroy the thyroid tissue over time. And because of this destruction of the thyroid tissue, the thyroid cannot produce as many hormones, and this is why Hashimoto's disease is often associated with hypothyroidism. Hashimoto's can occur in any human being, however, it is more common in women, and specifically women aged 40 to 60. Doctors are unsure of a definitive cause. However, it is more common if your family has a history of other autoimmune disorders. With all that being said, one of my best friends who's only 20 years old has Hashimoto's, and her family does not have any history of autoimmune diseases, so that is just real-life proof that it can happen to anyone for a variety of reasons. With Hashimoto's, symptoms often won't show up for the first couple of years. The most common symptom that might appear would be a goiter in the neck, which is shown in these photos on the right. A goiter appears when your thyroid is enlarged, mainly because it's trying to overcompensate for the lack of hormones being produced, so it does enlarge itself. When you go to the doctor will most likely ask you a series of questions, such as, has your voice changed at all recently, or have you gotten hoarse more easily? Or have you been feeling sluggish, or has your mood changed at all? But in order to officially properly diagnose Hashimoto's disease, a blood test must be taken in order to see if you are not having enough thyroid hormones or thyroid stimulating hormones being produced in the pituitary gland. A hormone blood test would look to see if the thyroid hormone levels are low, or if the thyroid-stimulating hormones are elevated because they are trying their best to get your thyroid to produce more hormones. Another option for testing for Hashimoto's would be an antibody test, and that antibody test would look for the thyroid peroxidase antibodies. However, not every patient with Hashimoto's will test positive for this, so that first hormone blood test would be the more vital one in order to diagnose Hashimoto's. Other common symptoms associated with Hashimoto's include tiredness and weight gain, and that ties into the thyroid being important in your metabolism, which then coincides with another common symptom being depression. The real cause of these antibodies attacking the thyroid gland is unknown. However, like I mentioned earlier, the risk of getting Hashimoto's runs higher if your family does have a history of any other autoimmune diseases. Treatment for Hashimoto's is relatively straightforward. Your doctor will most likely prescribe a synthetic hormone called levothyroxine, and that levothyroxine will mimic the hormones that are running low because of your attacked thyroid gland. And this medicine are just little pills that you can see in the picture here that you would take daily, and the proper dosage can be determined through blood tests after experimenting for the first 6 to 8 weeks in order for your doctor to find out what dose will work the best for you. And then once the proper dose has been established, your doctor will most likely have you come in every 12 months, around every year, to monitor your TSH, or thyroid stimulating hormones, to make sure that everything is still in balance and doing well. If left untreated, Hashimoto's can be serious, because hypothyroidism can lead to other problems such as heart problems or severe depression. However, that being said, this disease is very easily controllable with the proper medication and dosage if you take it daily. Another super important aspect of wellness is a healthy diet and adding exercise into your daily life. Multiple studies have shown that a gluten-free diet has been known to make people with Hashimoto's feel a lot better on a daily basis. And in a study done in 2018 by 3 last names that I'm about to butcher, Krzyzak, Skrobka, and Akopian, it was found that a gluten-free diet not only reduced thyroid antibody levels, thus improving the thyroid function, but it also boosted vitamin D levels when they compared the gluten-free diet group to the control group. As for specifically ethical issues surrounding Hashimoto's, I couldn't really find much information online, and the few studies that I could find were all like $30 in order to access the PDF articles, so I had to skip that route. But with that being said, I wanted to look more into the accessibility and cost of the levothyroxine medication. So that main medicine or hormone that's used to treat Hashimoto's is pretty affordable. A prescription for a 30-day supply only costs around $5 to $10 at most pharmacies if you have insurance or if you're using coupons from sites such as GoodRx. And Medicare and most insurances will cover this drug to get it down to be about $5 to $10 or $15 at the most, because it is vital for treating Hashimoto's or, in turn, hypothyroidism. That is all. Thank you for listening.